homeless, friendless, and without the knowledge or resources to survive independently in society. Many foster children without families lack the stability and nurturing required for a happy and healthy upbringing. Within 4 years of aging out of the foster care system, 50% of these youth will be homeless, victimized, incarcerated, or dead. In partnership with the American Leadership Forum, Michelle Callejas, Deputy Director, Sacramento County Child Protective Services, and Bob Herne, CEO of Sierra Forever Families, tell the stories of these children and what is being done to make the odds more favorable. Next on Studio Sacramento.
At Five Star Bank, we create thoughtful solutions to help the Capital Region thrive, from economic development and education to public health and safety, issues that are vitally important to Sacramento's prosperity. We're proud to be part of the conversation and hope you'll join in.
Michelle, what is the scope and depth of the foster care issue within our region?
So first of all, thank you very much for having us on air. This is a really important issue, and I appreciate the time you're taking to give to it. So we currently here in Sacramento County have 2,160 children in foster care. It has significantly improved. Back in 2009, we had over 31,000 kids in care. So we have slowly reduced the number of children in foster care, but 2,160 is still a large number of kids. What we know is that roughly 56% of kids will go home within 2 years, and then a certain number will go home after that. But really there's about 40% of kids that will not be going home to their biological families, and it's incumbent upon us to do the best job possible to find strong families who will adopt or provide legal guardianship for them. And we hope to get the word out today that we really want community members to come forward and serve as resource families for our kids in foster care so that they can have a loving and stable family.
Tell us about your agency.
So Sierra Forever Families' mission is to transform the lives of children in foster care by both building and nurturing permanent families. So our belief is that although sometimes for a child's safety they have to enter foster care, every child should grow up with the love, safety, and unconditional commitment of family. So our whole raison d'etre is to ensure that those children either get reunified back to their biological family or we find another family who can claim these children. And we partner with Michelle. Our point of distinction is we look at those kids who have been in foster care for more than 2 years who aren't going home and aren't in the adoption unit. Those are those kids that if we don't do additional efforts are going to age out of the system and become part of those statistics. So due to our partnership with Michelle, we're able to work with over 100 of those children at a time and those youth to ensure that they grow up in a forever family.
So these children make up the 40% that Michelle was talking about.
Yes.
A few minutes ago. Mm-hmm. Tell us more about these kids. Who are they?
So these kids are the spectrum of any child who you would see out on the street, both in age and diversity. But these are children who many times have suffered greater neglect or abuse. We've been unsuccessful in being able to safely reunify them back to their family. And these are children who every 6 months are being moved to another family. So these are children who over time have an additional loss and trauma in their lives. And so as soon as possible, we need to find a home that can create.
What does it do to a kid, Michelle, when they're moved every couple of months just as they're starting to get settled in a place? What is it, how does that affect them over time?
Well, there's a profound effect. First of all, when we as an agency do whatever we can to keep children with their families. Not only do we believe that children should be with their families when it's safe to do so, but we're statutorily required to do whatever possible to keep them there. So we make great efforts to provide services to families to strengthen them so that we can keep kids at home. When we remove, it is very traumatic for a child, even though they have experienced abuse and neglect. To be removed from the only families they know is extremely traumatizing. And when we bring them into care, we first try to get them with a relative who knows the child. If not a relative, somebody else who knows the child. Could be a neighbor, a teacher, a coach. But if not, we place them into a foster home that the child doesn't know. If that child has some challenging behaviors, which many of our kids do because of the trauma they've sustained, sometimes caregivers will give what we call 7-day notices. They say, can't handle it. And so we take the child and we oftentimes have to take them to our shelter until we find another placement if we haven't been able to find one fast enough. So then they go to another home. And they begin to feel safe, something happens, and we get another notice. Sometimes it's 7 hours, sometimes it's 7 days, sometimes it's a couple of hours. Every time a child is disconnected from another adult that they're supposed to be able to trust, there is more trauma. And the kids begin to not trust who they're placed with. They become it becomes more difficult to connect with them because they're not going to connect because they know they're going to get hurt. The longer a child is in care, the more likely they are to experience multiple placements. And the more placements they get into that aren't successful, the more likely they are to end up in a group home. The more likely they are, the more they're in a group home, the more likely they are to cross over to our juvenile justice system, and most importantly, the less likely they are to find a permanent family. So it's impactful when children are not only removed, but continue to be removed.
What is it that leads a child to end up in foster care in the first place? Take us back to sort of the root of where all of this starts at.
So I'm going to pass that over to my county partner because they're the people who actually remove children. We're the ones that provide the resources. Mm-hmm.
So I will say that, you know, by the time we get a phone call, so we have a hotline, a child abuse and neglect hotline that's run 24/7. We get over 5,000 calls a month, but less than half actually are related to child abuse and neglect. The others are, what's my social worker's number, what's the probation officer, it's unfortunately sometimes a 411. So a little over 1,500 are actually related to child abuse and neglect. Of those, about 877 on average lead to investigations. So we've determined that the allegations are sufficient enough for us to go out and investigate the family. Of the 877 families, it represents over 1,300 children. So that's 1,300 children where there's suspicion of abuse or neglect. And then when we investigate, we remove roughly 8%. So about 112 or so.
That doesn't sound like very much.
You know, it isn't in the context of how many calls we get, but it is for that 8.5%, right, for those kids that have been harmed. And my hope is that we're able to strengthen our community and invest in strengthening families so that kids can stay in their homes. But again, when they do come to us, the first thing we do after we find a placement is try to get them back to their homes. Research shows that if kids are safe in their home, they can be with their families, outcomes are far better.
So I don't want to be unfair, but Child Protective Services, the only time that I ever read about or see your agency in any way in the public, it's always negative about some child that has died, been hurt, had fallen through the cracks in the system. When I'm listening to you, I'm hearing what you're saying, But tell us from your perspective about how confident we, the taxpayers, should be in the work that your agency is doing.
So I think we have made some significant changes over the last few years. And by the way, it wasn't an unfair question. It's a very fair question. Anytime a child dies is tragic. And we do whatever possible we can to learn what happened in each and every situation. We review every child fatality, or even if it's a near fatality, or where something has gone wrong, where the child is fine, but we think that there has not been good practice. We break it down. We have invited members of our CPS Oversight Committee to be part of our work group and case discussion, so they get to see everything that went well and everything that didn't. And what we do is we look at lessons learned, we develop strategies and trainings, we identify whether it's a system issue, a practice issue, or a policy issue. And sometimes we haven't equipped our social workers with the resources they need to do their job. But we take those lessons learned and we feed them back to our managers, our supervisors, and most importantly, our line social workers. So we're making improvements. There are so many kids and families that we go out on where we never remove their kids, and where we are able to put services in place, and we're able to strengthen the family. We're now investing. We entered what we call a federal 4E waiver. It's basically we're allowed to use funding in a way we never have been able to. It used to be the more kids we took in care, the more money we got. And the minute they went home, our money stopped. Now we're able to invest in keeping kids home. Before, federal 4E dollars weren't allowed. We're investing over $4.5 million in in-home supportive services, in 9 family resources in our family resource centers in our community in high-risk areas, so that they can do evidence-based home visitation services, evidence-based parenting classes, so that they don't come back to us, or they don't come to us in the first place.
Let me ask you, Bob, what is it that you wish that CPS was better equipped to handle that would make your job easier, or the population that you serve smaller?
I'm very happy and proud, especially the last several years, of the partnerships that we've been able to work on together and really team. Sacramento Child Protective Services has been such a great partner over these past couple of years, and the impact we've been able to have on our kids by sharing our resources.
But what could they do to make your job easier and the population smaller?
I would say I won't look to Child Protective Services. I would look to our community. So when there are children's deaths, there are people in that community who knew what were going on and sometimes didn't report it. If you read about those children's deaths, there are a lot of people who will say, I won't get involved. We all walk down the supermarket and sometimes see things that are going on that we know are abusive, and many times we choose to look the other way. And Child Protective Services and community-based organizations can only be as successful as they're able to garner the support and commitment of the community to work together with them. So I think the reason why we're here today is in Sacramento, there's 2,000 but in our area, there are 5,000 children in foster care. This is a problem we can easily solve in our community. If we had our whole community come together to say, these are our children, we want to provide resources for these kids, so that each of these kids has the love, safety, and unconditional commitment that they need in order to thrive.
Let me ask you the question a different way. Do you believe that the people who make the decisions on where resources go put enough resources into addressing this problem?
No. And it's at every level. It's at the social work level. It's certainly at the court level. I don't know, it's hundreds of cases that each child's attorney has. They don't have the ability to develop and establish the relationship and truly advocate with knowledge about what's going on. We don't give enough resources to our foster families who are now calling resource families. There is not enough mental health and support services and WRAP services. So it's quite interesting that when a child is first removed, they're considered a victim, and within a year, they're considered a behavior problem.
Wait a minute. Slow down on that. Go a little bit deeper on that, because I've never heard that before. You're saying that at first they're considered a victim, and then they're considered to be a problem. How do they evolve into that? How does the determination of what they are evolve?
So let's look at going through the child welfare system through a child's eyes versus through an adult's eyes. So here's a child who's living in the only family environment they've ever known, which we might find horrific, but they don't know any better. So we come in, we remove that child. In many cases, we remove that child to a family in a place that they've never been before. And many times, they're young children who have no cognitive ability to understand what's going on to them. They're then thrust in having lawyers and social workers and moved from home to home to home while we try to figure this out. And all the time, they're trying to figure out, and sometimes if they're part of a sibling group, they've been removed from their brothers and sisters. And so the only support systems that they know are no longer there. So they're thrown into this cavalcade of confusion and not knowing, with multiple people coming in and out of their lives, and all of a sudden court cases and lawyers coming in. And then what we see is then we try to get them to a relative, and then we have to try to figure out who all these relatives are. In many cases, we've worked with kids, because we work with kids who have been in the system for a long time. Some of these children have been in 30, 40 different homes.
What?
And so then what is it, the statistic? Every 2.5 years, a child has moved an average of 5 times
like that,
in Sacramento County. So if you're lucky and within 2 years you get back into your biological family, that's great. But for these kids who are in care for a long time, we used to be called Sierra Adoption Services. For 25 years, we're Sierra Adoption Services. And we would wait for these children to go through their journey in foster care. And then when they got to the adoptions unit, we would say, here's this beautiful, loving home. And for some of our kids, they're like, this is the 40th home I've been in. What are the rules? What time do we eat? What do I need to do? Their ability to attach have been damaged. They had gone through so much loss and trauma. And so we changed our name to Sierra Forever Families, and we ask our families to come in to take a child as soon as they're removed, to help them to get reunified back to their family, and if that fails, to adopt the child. People say, how can you ask families who want to grow and fall in love with this child that they might have to give this child back to the biological family? And I always turn to them and go, how can you ask a child who has no support, no cognitive abilities, no power to control what's going on in their lives, to go through these multiple different homes? And it's by time we started putting child back into Child Protective Services and focusing on the needs of the child.
That's really interesting. Is the system and the law set up for the benefit of the parents that the child is being removed from, or for the child?
So I think there used to be far more focus on parent rights. And over the years, it has really shifted to putting the child first. And so that's what we do. We believe children should be with their families, but when it's not safe for them to do so, then we intervene and we remove them. And then we do whatever we can to get them back, and we try to mitigate the safety and risk issues.
How do you know when it's time to cut the cord and this child or these children are never going back to their biological families, and his agency needs to find them a permanent home?
Well, ideally what we're doing is exactly what Bob said earlier, and it's like concurrent planning. The minute a child comes into care, we hope to get them with a relative or someone known to them that is willing to support reunification, but if that doesn't happen, they're willing to keep the child or youth in their care and either adopt or assume legal guardianship. That is our desire. And that is what we try to do. And then in coordination with Bob, if they're not able to assume legal guardianship or adopt and they don't want to keep the child, then we will ask Bob or another one of our foster family agencies to provide a forever home, find a forever home for the child.
So the term that you all are using is resource families rather than foster family. What does that mean? Because it sounds like some politically correct something. What is that?
So several years ago, the state of California really wanted to reduce the number of children who are growing up in group homes and congregate care. And so the California Department of Social Services set up this project. And what they realized is you can't change one part of the system without changing the whole system. So currently we're in the largest child welfare change in a quarter of a century called the Continuum of Care Reform. And it really states that we need to be focused on the child, that every child when they enter care should have a plan, that there should be a coordinated case manager, that service should be integrated, because right now a child could get mental health one where, IEP services someplace else, foster care someplace else, with no one ever coordinating. They could be working at opposite ends and really confusing the child and the family. And so, and they really have promoted the community coming forward how they can to be resources for these children. So getting these children out of group homes and into family-based settings, because we know that increases permanency, for every child to have the mental health and support and WRAP services they need. And so we, instead of calling them foster families, are calling them resource families. And one of the big differences is before you could either be a foster family or go and be an adoptive family. And now all foster families will automatically be approved, have an assessment done that approves them at the level of adoption. So we're hoping that will be a barrier to remove many people from creating legal permanency if reunification doesn't work. But there's other ways that the community can come forth. We need mentors, we need volunteers, we need CASAs. We need our entire community to come together as resources to meet the needs of our kids.
So I want to know, we used to have orphanages. When if children had nowhere else to go, there were orphanages. And some believe that that provided at least a level of stability in the absence of anything else. We now have group homes of whatever size that I guess is a smaller version of the orphanages. Why are those not optimal solutions?
So if we look at our own families, if we look at our own kids, every child needs to have an adult who's unconditionally committed to them. They need that stability, they need that support, they need that guidance. Having multiple, there are some youth at some stages, a small percentage, where congregate care might be good. For the vast majority of children, they need that stable parent source, not a different shift coming in. I worked at a group home for 3 years. I'll never forget Sandy turning 18, having a birthday party for her. I was 23 years old, and the child welfare worker came in Canada, it's child aid worker came in with garbage bags and said, pack up all of her stuff. She's turned 18, she's going out. Sandy couldn't make change of $1. So I'm thinking, where are you moving her? Well, we're moving her to a boarding home. This was a young woman who couldn't read a book, who couldn't make change of $1, who we're sending out onto the streets at the age of 18 with no one to care about her. And what research shows is that youth who grew up in a group home have the most difficulties. If you're looking at those statistics and who they are, now that's not all youth, but it's not a place for our children to grow up.
So for people who are joining us and want to get involved or potentially want to consider being a resource family or being somehow a part of the solution, what would you recommend?
So as Bob said, I mean, we would love to have families come forward. And it doesn't matter if you're married, if you're single, if you own a home, if you rent a home.
Who do they reach out to?
So they can reach out to the Department of Health and Human Services, Child Protective Services, and we can connect them with our Resource Family Approval team. They can also reach out to Bob's agency, Sierra Forever Families, and they do their own orientations and approval processes for resource families.
Bob, what is the biggest misconception that people who might be considering becoming a resource family that you have to disabuse them of?
I think there's many. One is you don't have to own your own home. You don't have to be married. You can be part of the LGBTQ community. You have to be able to meet your own needs, but you certainly don't have to be rich. And I think the biggest misconception is people think they need to be perfect. And it's the exact opposite. It's the challenges that you've had in your life that you've accepted and overcome that gives you the empathy and makes you such a great resource family.
Thank you. And we'll have to leave it there. That's our show. Thanks to our guests and thanks to you for tuning in to Studio Sacramento. I'm Scott Syphax. See you next time right here on KVIE.
At Five Star Bank, we create thoughtful solutions to help the Capital Region thrive, from economic development and education to public health and safety, issues that are vitally important to Sacramento's prosperity. We're proud to be part of the conversation and hope you'll join in.
All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.